Honorable Speaker and honorable members, allow me to add to the responses that have been given by the chair of the SHA. And I'll go by the questions asked by the honorable members. I'll start with the Honorable Faith on the challenges, specifically on how long does it take to get approval and for you to start using your SHA registration. Approval for treatment, we have automated. If there is need for pre-authorization, that has now been automated and it doesn't take long. If you have paid, immediately you pay and you go to a facility, you will be entitled to treatment, as opposed to the previous NHIF, which could take you not less than 6 months. Dr. Honorable Undo, on the registration of 18 million, Kenyans have registered to the tune of 18 million, and they continue registering right now. I think it's 18.5 million. What measures have we put in place to ensure that we have the funds? Number one, all members who are salaried, automatically every month on the 9th, the employer should remit their 2.57%, 2.75%. For those who are not employed, they are required to undergo the process of means testing so that they can ascertain the amount of money that they are supposed to pay. And immediately they pay, then they will be entitled or they enjoy their privileges. So we are making sure that we have the funds under the Social Health Insurance Fund, but we need money for the primary health care fund, which is funded through the exchequer. That is the money that we are asking, that we need additional money through the exchequer, because what has been provided is less than what the provision is. And I think our chairman made that presentation. We also need money for the ECCIF, that's Emergency Chronic Illness Fund, which is fully funded by the exchequer. So that's what we are demanding or asking to be funded. The honourable member from Mombasa, services that require extra money, yes, at times where the benefit package, the limit of the benefit package, and if the service rendered is more than that, then you will be required to pay the extra. We are simply saying every treatment has a cost that has been costed by SHA. Anything over and above, you pay that. And that's why you see extra money being demanded. Honorable Kibagendi, on the issue of the health benefits, I think I have circulated this through the clerk to the National Assembly. You will be receiving the benefit package. How much are you entitled for each and every case of SHA? So more members will be getting the entire list, the legal notice rather. On the issue of debts owed to the facilities by NHIF, honorable members, you remember in the month of October, the total amount that due to the facilities on the 4th of October 2024 was 19 billion. Of that 19 billion, honorable members, so far we have reduced it to about 9 billion. So that means we have paid about 10 billion. We know that the NHIF owes the facilities, and the law provided for that all the debts, liabilities of NHIF will transition to SHA. Therefore, SHA is making progress to ensure that we clear the outstanding debts. We have given directives to SHA as a ministry to undertake audits to confirm the total outstanding debts that belong to the facilities. Once you get that total outstanding debts, honorable members, SHA will start making progress and arrangements to clear the outstanding debts. On the issue of not paying promptly, I want to tell you, honorable members, that SHA currently is up to date. The challenge could only be where the claims are being audited or the claims are being scrutinized for the purpose of confirmation whether indeed that management, that prescription was the right one. So we are prompt on our payments, and that's why we said we want to be up to date on the SHA issues. Honorable Professor Jaldesa, on cases of ECCIF, as I said, and ICU specifically, it is true, we did not have enough money. We had anticipated to have about 60, if I'm not wrong, about 61 billion for the ECCIF. We only got 3 billion. In fact, as of now, there is outstanding debt that we're still demanding of 1.8, and that's on a reduced. If you look at the ICU bed, normal ICU bed, they will charge about 15,000, 20,000 per day. SHA pays a rebate of 4,600. So you will see a discrepancy in there. But as we have requested, we still need additional money to cater for the ECCIF. On the issue of indigents, previously we used to pay for the indigents, and that figure used to be constant. It was a figure that was a number that was submitted by the social protection. We had a meeting with social protection. We have told them to revise that list, and we have been given the list, and therefore we are going to update. We have 950 million Kenya shillings that now we want to pay for those indigents that have been identified by social protection. We also subject the indigents to what's called a means testing to ascertain whether they are able to pay or not. On the question of the former NHIF staff, honorable members, I want to state here clearly that all NHIF staff currently have been onboarded back to the public service and deployed to Social Health Authority for a period of 6 months to support SHA in implementation of the rollout, to give SHA an opportunity to onboard the number of staff that they will require. The rest of the staff that will not be onboarded into SHA will revert back to their public service, and they will be posted to any of the government agencies. So no member of staff of SHA will lose their jobs because they are already public servants. Honorable John Paul, on the issue of the shift not working, I want to confirm here that where the facilities have been empaneled, those facilities are providing services under SHA. Those that have not been empaneled or accepted to be empaneled are the ones that are not offering services under SHA. The issue of payment for medicine, I think once you go for treatment, the doctor looks at, examines you, gives you a prescription, and therefore that is what is prescribed as your benefits. It includes medicine. On the issue of the patient who came to petition the Ministry of Health, honorable members, we take note, and what Madenga said is true. We had that system downtime at that particular time, and specifically where we had a big challenge was KNH, Kenyatta National Hospital, and that issue was addressed. The only, I think, what the police or the DCI have come to do is the chaos that the patient came to cause at the ministry. Otherwise, the ministry acknowledges, and SHA also acknowledges. Honorable members, I have said we apologize. We apologize first for there was downtime. I want to leave that.
Yes, Kimutai, please note that this is a very common issue, and there needs to be a whole government approach on it.
Speaker, thank you, Honorable Speaker.
Thank you. Thank you, Madam Speaker. Thank you, the peers, for your answer. Madam peers, you can see this is an issue that touches every member. The woman who was harassed is 61 years old. That's an elderly woman. Somebody's grandmother, not just a mother. Yes. And on top of that, this is a person who was seeking services. Yes. Was frustrated. You have acknowledged there was a problem. Why is that woman being arrested? I am asking the police, please arrest the people who disrupted the system. They are the ones who are causing disturbance by disrupting the system. Not a woman who is sick, who is seeking assistance. It's very annoying. Honestly, it's very annoying. When you see a woman 61 years of age, 61 years of age, 61 years of age.
Thank you. Thank you, Speaker. Thank you. I think The Speaker has directed that this...
Order.
Thank you. On Honorable Salasha's question, Honorable Speaker, whether...
You made your point.
Honorable Speaker, on the question from Honorable Salasha, whether public participation was conducted, I want to confirm to the members that public participation was conducted when we were coming up with the Social Health Authority Act and the other acts, and I think, honorable members, the House also participated, the Committee of Health also participated in public participation.
And let's now listen to the other issue.
And best...
They will address it, don't worry. Order.
The honorable member Salasha also asked whether we learned from the previous launch, the experiences of the previous launch of the UHC. I want to confirm that indeed we learned from the experiences of the piloted 4 counties. And what we noted then was that there was lack of legal framework to support universal health care coverage, and that's why we passed the 4 laws that are meant to support the rollout of the UHC. On the issue of the cancer patients, we take note and have said that we have considered a committee, a team, what's called the Committee of the Benefit and Tariff Package membership that will review the benefit package for cancer patients, because we realize that the cost of treating cancer has gone up and we shall adjust according to the market rates. Honorable Mutunga, Dr. Mutunga, on why the confusion during the transition. There's always bound to be confusion because we took members of those members who are managing facilities, we took them through in terms of what are they supposed to do with the system. They needed to understand how the system works. How do a person comes? You remember we said we use your ID card. So there are those who are facing challenges. Some of those, when they go to the facility, you realize that they are not paid for their premiums. So at that particular time, some of the members of the public or patients were being told, you either pay cash or have your premiums activated. And I think that is where we had some challenges. I've talked about the oncology benefits, and I think I've said we are having a committee that's going to review these benefits of the oncology, which is specifically cancer. Honorable Madenge, I think the issue of grace has been addressed. The NHIF system, I've also talked about the indigents. We have the 950 million, which we are now working with the State Department for Social Protection to ensure that we capture those ones and we pay for them. The issue of no visibility of SHA system in the branches. I think the system is used by the facilities. All the facilities who have been on panel can access the system, can use it, and they can see the claims that they have lodged. So I think there's visibility. And on the issue of the SHA staff, I think they have also the rights to access the system. Those who are supposed to access the system are given rights. Honorable Emase, on how long does it take to activate the data of an individual? I say that immediately you register and you're a paid up member, you're an active member there and there. So it doesn't take long for you to be activated. Patients who are registered and not paid up, yes, any patient who is registered and not paid up, when you go to level 4, level 5, level 6, where we expect you to use your social life insurance fund contribution or premiums, you will get services there. But if you have not paid, definitely, the eligibility will be that you have not paid up member and therefore it will reject you. But for those who have registered, they can access their services at level 2 and level 3 without paying any premiums. So the other issue is very little is being paid. Sometimes it depends on the benefit package. If the benefit package means that you clear everything, then you will be entitled for that amount. So it does not go by an individual. It goes by the benefit package that you are supposed to access. Honorable Mheshimiwa Barto, on the classification, I want to report here that yes, there are 3 funds. The public health care fund, which is for level 2 and level 3, that is exchequer contribution. Social health insurance fund, which is referred as SHIF, is your personal premiums that you pay as a registered member. And the ECCRF funds are the funds that come through the exchequer, and it is for the members who are registered. So these are 3 different categories of funds, and you will receive the services accordingly. Honorable Kirima, on the SHA registration, and especially now, once you are registered as a SHA member, it doesn't matter where you are going to get your service. Once you are registered, you go to any county, you go to any facility, you will be entitled to services. You are not blocked like before, where NHIF used to say you must be a member registered for a particular facility. Under SHA, a member can go anywhere and he will be treated across the country. And I think the issue of contribution, we are all contributing to the pool of the social health insurance fund, whether you are paying 360,000 or you are paying 12,000 or whatever amount of money, that goes to the kitty, goes to that contribution where all of us benefit from it as an insurance. The Mheshimiwa Honorable Opara on the no service in Kasipul Kapondo, it is something that we require to investigate, but I so believe that any facility that is registered and any panel must provide service. We have not had cases where there are complaints from Kasipul Kapondo, but as I've told my team, SHA here will follow up whether there are facilities that are not getting services in Kasipul Kapondo. Yeah, the issue of the premiums, I think we have all agreed that you pay according to your salary, your income, it is 2.75%. That is the contribution. So, Honorable Bashir, on the issue of the pastoralist, I think we have the community health promoters within those communities. They are supposed to support in registration, and when they move, because they come from that community, wherever they go, they will always move with their community health promoters. So they will continue registering. So I think the issue here is campaigns that we must take to our people so that they register wherever they go, because we have mobile registration, because you simply use your phone to register. So it's not a complicated issue, it does not require you to go anywhere. It is indeed a mobile registration. Honorable Speaker, thank you. I so believe I've responded to the questions.